Hi everyone, Pharma Questions here. In today's video we'll be taking a look at drugs which can discolour urine and bodily secretions. I'll be sharing some tips, tricks and mnemonics on how to remember which drugs cause which discolorations. Here is a quick overview of all the drugs that we'll be covering in this video. You can screenshot this as a quick reference guide for future uses. So let's begin with the first drug, nephropam. Nephropam is indicated for moderate pain and can cause pink urine discoloration. I usually remember this by the letter P for pink, as you can see in the image above. The next drug we'll be looking at is fenindione. This is an anticoagulant which works similar to warfarin, however it is now very rarely used due to its potential to cause serious adverse effects. Fenindione can cause pink or orange urine discolorations, and you might be thinking, how will I remember this? Well, once again we can remember this by taking advantage of the drug's name. As you can see here, P for pink and O for orange allows for this to be remembered quite easily. The next drug we'll be looking at are prostaglandin analogues. These are a class of drugs used to treat raised intraocular pressure in open-angle glaucoma. An example of a prostaglandin analogue is litanoprost. This drug has the potential to cause brown pigmentation in the iris, which I find super interesting. Being able to visualize this side effect really helps with memorization, so I'll be sharing some images of this effect. Here you have the before image of blue eyes, and after the use of litanoprost you can see that the eye colour has changed to a blue-brown shade. The next drug we'll be looking at is sulfathalazine. Sulfathalazine is an anti-inflammatory drug used to treat Crohn's disease, ulcerative colitis and rheumatoid arthritis. This drug has the potential to cause orange urine discoloration, and I usually remember this by the colour of the tablets. On my pre-registration training, whenever I handled this medication, I noticed that pretty much every brand of tablets was some shade of orange, and this applied to the packaging too, as you can see from the images. Being able to associate information like this to random facts really aids with memorization. The next two drugs we'll take a look at are bismuth and iron. Bismuth has an unlicensed use to treat H. pylori infection, and it can also be found in some indigestion preparations. And iron is, well, of course, used to treat iron deficiency anemia. And I find these two drugs pretty interesting as they're able to cause black tarry stools, and bismuth is also able to cause black discolorations of the tongue, as you may be able to see from the image. And a good way to memorize this is by B for bismuth and looking at the I for iron as an L, so BL stands for black. The next two drugs we'll be taking a look at are Senna and nitrofurantoin. Senna is a stimulant laxative, and nitrofurantoin, of course, is an antibiotic used to treat urinary tract infections. These drugs have the potential to cause yellow-brown urine discoloration. I'm able to remember this by the colour of the tablets and the capsules. Pretty much every Senna preparation I've seen is a mossy brown colour. And as for nitrofurantoin, this is a similar case. The capsules are usually a brown and yellow colour or just yellow. So you can see this from the images above. And I've added the images just because, as I've mentioned before, being able to visualize stuff and associate information with random facts really helps with memorization. The next three drugs we'll be looking at are deferiprone, which is used to treat iron overload, entacapone, which is used as an adjunct with other drugs in the treatment of Parkinson's disease, and clofazimine, which is used to treat leprosy or complications of leprosy. These drugs have the potential to cause brown-red urine discoloration, and I'll be sharing a small story on how you can remember this. So taking the first letter of each drug you get the name Deck, and this is Deck, and Deck's favourite piece of clothing is his brown and red hat, which he wears all the time. I hope you enjoyed that story. So the next two drugs we'll be looking at are rifampicin and rifabutin. These are antibiotics used to treat a number of different infections such as endocarditis and tuberculosis. And these two drugs can cause red or orange urine discoloration. And I'm able to remember this by the first letters of each of the drugs, which is R for red. And I'll be sharing another little story with you all. So here we have Mrs. Reefer and Miss Reefer. They are neighbours with the same name, which is quite rare as the name is unique. And Mrs. Reefer's favourite colour is red, so she always wears a red head covering, whereas Miss Reefer on the other hand loves the colour orange, so she chooses to wear an orange head covering. So I hope that proves to be useful, and there will be a quiz at the end where you can test yourself to see if these tips and tricks or small stories have helped you. And now we look at the next drug, which is Triamterene, and this is a diuretic used to treat oedema or potassium depletion which may occur with thiazide and loop diuretics. So Triamterene causes blue urine discoloration, and I remember this as it is a red herring and it's the odd one out compared with other drugs that cause urine discoloration in this video, as it's the only one which can cause blue discoloration. Now let's have a look at the final three drugs, which are Dantrons. These are used to treat constipation in palliative care that is usually caused by opioids. And the next drug is Doxyrubicin, which is a chemotherapy agent. And last but not least, we have levodopa, which is used to treat Parkinson's disease. So these three drugs have the potential to cause red urine discoloration, and we'll look at these in a bit more detail, which will help us remember. So Doxyrubicin, it's known as the Red Devil due to the vast amount of side effects it can cause, such as anemia, heart failure, mouth sores, and of course red urine. And the drug itself is a really bright red colour, as you can see from the images. And Dantrons and levodopa, as mentioned before, can also cause red urine. And this can be remembered by the following mnemonic: do like red, D for Dantron, and L for levodopa. And here we have another mnemonic which includes Doxyrubicin too, definitely does like red. I'll now be sharing some quiz questions so you can apply all of the knowledge you have learnt, and let me know in the comments below how many you got right. And that concludes this video. Thank you for watching, and feel free to leave a like if you learned something new or subscribe for future content. Bye!